My name's David Atkinson. I'm a patient on dialysis for 25 years.
My name is Sarita and I'm a renal transplant patient. I was on dialysis, on hemodialysis for 10 years before I had my transplant 10 years ago.
My name's Chetan Joshi. I'm 51 years old. I started dialysis in 2013 after several years in the pre-dialysis clinic. I was on dialysis for just over 2 years before I was lucky enough to be blessed with a altruistic kidney.
Preparing for an appointment, obviously I do put down the questions I need to ask. I find it convenient to put them on my phone in notes, so they're easy to access and ask, including if I have my repeat medication to be requested. It's so easily forgotten when you go for the appointment. And by the time you come out, you can't go back again because they are so busy.
My doctors invariably ask me about my medication and which medicines I'm on, and it's quite confusing when you're taking half a dozen or more different medications and different dosages. So what I do is I keep the prescription counterfoil with me. Instead of writing down a list, I've got a printed list with me at all times.
I do go over my results, my previous results, and if I feel that some results may raise question, that goes into my questions to ask them. Do I need to worry about this, or have they looked into it?
I usually check my lab results on Patients Know Best, and when I go to the doctors, I kind of got a couple of things I've got to check with them and see how that goes, and any suggestions of how I can improve, that sort of thing.
Write down your questions, whether on your phone, on a piece of paper, whatever means you can do it. It's if you keep it in your mind, oh, I remember, there are chances you may miss something from there, because at the appointment, it goes all over the place, and you can easily forget to ask something that is important to you. Yeah, technology, if you are not used to it, or there are elderly people who aren't used to it, it's good to have somebody younger with them who knows about it. If English is not your main language, or you struggle with the accent, having someone else to be with you in the video call, letting the doctor know, I have so-and-so with me, and is a good idea, because somebody can catch what the doctor is trying to say, and that may be important, invaluable advice. I wait till the end, because we do share our results from the previous blood test, which was, like after transplant is every 3 months. And being on this app, Patient Knows Best, I already know my results. So if I any question regarding my results, they go into my questions. And when it discusses results, that is the time to prompt based on the results. I would ask the question. But there are other questions not related to the results. Then I wait for the end, towards the end of after doctor has spoken and done my repeat medication and things. Then I said, I need to ask you. Very often than not, they do ask, is there anything you will want to ask?
Usually I'll ask these questions when they actually finished, and have you got any more questions? And they'll say, well, yes, I have got one question.
I'd like for the doctor to explain to me what I can do in the interim period between then and my next appointment, what improvements I can make. To leave the appointment knowing that things are in hand and doctors know roughly how things are going to progress with my condition.